This station is designed to test your ability to manage a pre-hospital cardiac arrest by integrating CPR skills, defibrillation, airway adjuncts, and patient scene management skills. There will be an EMT assistant in this station. The EMT assistant will only do as you instruct. You arrive on the scene to find a patient on the floor. You must immediately establish control of the scene and care of the patient. At the appropriate time, the patient's airway must be controlled, and you must ventilate or direct the ventilation of the patient using adjunct equipment. You will have 15 minutes to complete this station. Takes or verbalizes body substance isolation precautions. Appropriately assesses patient and confirms no pulse. Directs rescuer to begin single rescuer CPR. Assures adequate CPR and adequate visible chest rise during ventilations. Properly attaches AED pads in the correct position. Turns on AED. Directs rescuer to stop CPR.
Apply pads to patient's bare chest.
Ensures all individuals are clear of the patient.
Stay clear of patient.
Initiates analysis of the patient's rhythm.
Shock advised. Charging. Stay clear of patient.
Delivers one shock.
Deliver shock now. Press the orange button. Shock delivered.
Immediately begins two rescuer CPR without performing a pulse check. Assures adequate CPR and adequate visible chest rise during ventilation. Verbalizes insertion of a simple airway adjunct, oral or nasal airway. Assures high concentration of oxygen is delivered to the patient. Assures CPR continues without unnecessary prolonged interruption during the 2 minutes.
Stop CPR.
Directs rescuer to stop CPR.
Analyzing heart rhythm. Stay clear
Ensures
of
all
patient.
individuals are clear of the patient. Initiates analysis of the patient's rhythm.
Analyzing heart rhythm. Shock advised.
Delivers one shock.
Deliver shock now. Shock delivered.
Immediately begins two rescuer CPR without performing a pulse check. Verbalizes transport of the patient. Complete station within 15-minute time limit.